Today I'm going to talk to you about the role of anti-hormone therapy in breast cancer. Now, anti-hormone or anti-endocrine therapy is given to those patients who have hormone-positive cancer. That is estrogen positive, or you may see this as ER positive. In these women, these cancers are given these treatments to block the effect of estrogen on the estrogen receptor, which I'll talk about very briefly now. The way to view this is that the estrogen receptor, or ER, is the lock, and estrogen, normal hormone estrogen, is the key. And you want to block the key from reaching the lock, because when the estrogen reaches the estrogen receptor, if there are cancer cells that express this receptor or have this receptor on it, then it can promote the growth of these cancer cells. So often women are given these treatments for 5 years, sometimes for 10 years. The question is, why do they do that? Let's go into the very simple explanation of why they do that. Most women who present with breast cancer of any kind, whether estrogen receptor positive or negative, present with early disease. That is disease that can be treated with surgery and also sometimes radiotherapy and chemotherapy. However, up to 25% of patients, years or sometimes decades later, may unfortunately get cancer recurrence. This is because when women present with the cancer has already released some cancer cells into the circulation. Now these are known as micrometastases. Most of these are cleared by the body. Your body is designed to clear anything foreign, which includes cancer cells. However, some stay silent for many years and can come back years later, or sometimes unfortunately months later. But blocking estrogen kills these cancer cells and helps the body to clear them, because you're stopping any estrogen from driving the growth of these cancer cells. These cancer cells stay hidden, they are able to grow, and then hopefully then the body finds them and kills them, and therefore you'll have a reduced risk of the cancer coming back. And as I mentioned, these are given for 5 years, sometimes 10 years. However, they do have side effects, so the evidence about whether to give it for 5 or 10 years is mixed, because do you want to give someone 10 years of treatment for a minimal benefit when you have 5 years of side effects, which I won't go into the side effects in this video. So understanding why you take anti-hormone therapy helps you understand why you have the treatment, and helps you understand why you should persist with taking it if your oncologist has prescribed it. But also it helps you understand why you need to make other changes to your lifestyle to help reduce the risk of recurrence. You can't just rely on the treatment. The treatment is important. You should take it if you're prescribed it. And if you're getting side effects, then you should tell your oncologist, because then you can try other treatments. There are several other second or third line therapies. But going back to that point, you need to make changes to your lifestyle to also help your body fight the cancer. The tamoxifen or letrozole or whatever drug you're taking helps in one way. You need to make changes to your diet, your exercise, your sleep, your stress, your gut health, for example. All these things help your body to be stronger, it boosts your immunity, reduce inflammation, and helps your body to defeat cancer, to help you also overcome some of the side effects of the treatment you need to take and reduce the risk of the cancer coming back, and also helps you to improve energy levels, beat fatigue, help you live your life to its fullest.